Welcome to The Advocates. I'm Aaron Dean. Dr. Leo Moore serves on the President's Advisory Council on HIV/AIDS, and his work attracted the attention of Men's Health magazine. Dr. Moore is the 2024 Men's Health Ultimate Guide. The magazine highlights men who have embodied health and wellness. Dr. Moore says that his life changed when an elective surgery caused his heart rate to plummet to 0. That gave his work new meaning. Moore is also the medical director for the LA County Department of Public Health, and his mantra is +1% every day. He's showing us that he is the ultimate guy in so many different ways. So for our audience, kind of tell them a little bit about yourself. What made you want to get into medicine?
Sure. So I knew that I wanted to be a doctor since I was 5 years old, actually. I come from a family of nurses. My mom's a nurse, my grandmother's a nurse, my aunt's a nurse as well. And so at the age of 5, I told my mom, we have too many nurses in this family. Someone needs to be a doctor. And at the age of 25, I became a physician, and I'm the first physician in my family. So it really has been a lifelong calling.
Wow. So, throughout your career, one thing that you specialize in, that you're known for is, talking about HIV and STD prevention. For you, why was it important to kind of zone in on this particular matter?
It was really important for me to zone in on this matter because it's one that has really affected many of my friends, and people in my community as well, as a Black gay man. So I knew from medical school that my passion was in HIV medicine and that I wanted to be able to get back to my community. And so that's when I decided to pursue internal medicine. Uh, and I recently also completed my certification in HIV medicine as well.
Yeah. And when we talk about kind of some of the statistics and things like that surrounding HIV and STDs, do you have any that come to mind that you want to share with our audience?
Yes, certainly. So, one statistic that comes to mind is a few years ago, there were CDC did a study where they showed projections for lifetime risk of HIV in certain groups if there were no changes to HIV prevention strategies. So, meaning if we didn't ramp up PrEP or pre exposure prophylaxis for HIV prevention, if we didn't ramp up PEP or post exposure prophylaxis. And what they found was that in Black men who have sex with men, that the rate was 1 in 2 risk of progression, meaning that there was a 50% chance of Black men who have sex with men or other gay men becoming HIV positive. And then they also saw in Latino men a 1 in 4 risk, so a 25% risk there as well. So we know that in our communities, there is, risk of progression to HIV, and so that's why it's so important for our communities to know about the many tools that are available for HIV prevention.
Well, yeah, that was my next question. Why is it so important to stay educated and also not only that, but fight the stigmas surrounding HIV, STDs, PrEP, PEP, and so forth?
I'm so glad you brought up the stigma because the stigma is pervasive. It's everywhere and it affects every aspect of HIV testing, treatment, and prevention. From a person feeling comfortable going in to get an HIV test, to believing an HIV diagnosis when it's provided by a physician, to staying on treatment, and to even accessing HIV PrEP and PEP as well. So we really have to address the stigma. And one of the ways we address the stigma is with education. People learning about how HIV is transmitted, with people learning about the various HIV prevention tools that are available to us.
And why do you think, this is happening in our community right now when it comes to the stigma? People would say, oh, it's, 2023, 2024. Why is there still this feeling surrounding these things? What's holding us back from furthering these conversations than where we are now?
Well, I think one of the things that's holding us back is that there's stigma at every level. So there's even stigma when you think about HIV criminalization laws. Many states still have these laws on the books, and these laws criminalize people who are living with HIV. So that's one thing. It's embedded, in the criminal justice system. It's embedded in healthcare as well. There is stigma that is even seen in healthcare environments as well, with providers and staff that are also not educated on HIV transmission and kind of where we are with that now. And it's also embedded in society. People not knowing that undetectable equals untransmittable, meaning that when a person has such low levels of HIV in their blood that it cannot be detected by a test, then they are unable to pass the virus on to others. And so we need people to know about U equals U, undetectable equals untransmittable. And we need to get rid of all of those HIV criminalization laws. And we need to ensure that our healthcare providers and different organizations, as well as everyday people, are educated about HIV.
Dr. Moore, your advocacy work and even your personal story has not gone unnoticed. You are Men's Health 2024 Ultimate Guy. How does it feel to be acknowledged on such a huge platform?
It is such an honor to be acknowledged on that platform. There were over 250 guys who applied to be Men's Health Ultimate Guy. And so I don't take that honor lightly. And I intend to use that platform to continue to educate and advocate for people living with HIV and people affected by HIV in this country.
Yeah. I read through the article and, you mentioned there was a part in there where you mentioned that you were given a second chance at life. Kind of share with our audience about what happened.
Yes, yes. So on January 12th, 2023, I went in for an elective procedure. And during the procedure, there was a moment where carbon dioxide was being infused into the left side of my chest, and my heart rate plummeted. It went from 89 beats per minute to 0 beats per minute. I was in cardiac arrest for 9 minutes and 25 seconds, meaning I did not have a heartbeat. I was not breathing for all of that time, and they were able to revive me after that, ninth minute or so. And so I believe that I was given a second chance at life because my purpose here on earth was not done, that there is more for me to do. And so, I mean, that's another reason that, this platform with Men's Health and these opportunities, I don't take them lightly because I know that this is all a part of me fulfilling my purpose.
Yeah, and like you said, with this second chance, how has that, even further pushed the work that you do?
That's a great question because my friends will tell you Dr. Leo is relentless, but it has made me, more relentless on another level. I would even say in my nutrition, in my exercise as well, just ensuring that my whole body and both mentally and physically is fit in order to be able to fulfill my purpose. So it's so much more than even just the care that I'm providing to others. It starts with self-care
Yeah.
and making sure that, I'm doing everything I can for myself to be healthy and then to be able to, advocate and educate others.
So I'll leave you with the final word. Tell us, what is the doctor prescribing for us today?
The doctor is prescribing self-care for us today. Particularly, during the holidays, we tend to be so giving of ourselves to others. It's really important for us to ensure that we are pouring into ourselves. We can't pour from an empty glass, so let's make sure that we keep our glass full.
Ooh, okay. Well, I'll take that prescription to the pharmacy right now because I need that. I need to take that in. Well, Dr. Moore, thank you. Thank you so much. One, for the work that you do and your advocacy. We greatly appreciate it. And congratulations again on being the ultimate guy.
Thanks so much, and thanks for having me.